All right. So, good morning, everyone, and welcome. Thank you all for taking the time to be here today. My name is Sophie, and I am going into my third year of nursing school. Today, we're going to talk about personal hygiene and self-care. I know this isn't always a topic people feel comfortable discussing, so I want to begin by saying that this is a completely judgment-free conversation. Everyone has different experiences, cultures, traditions, and routines that influence how they care for themselves. There isn't one right, single way that everyone has to do things. Instead, today's presentation is about sharing information on common hygiene practices, why they matter for our health, and how small daily habits can make a big difference. Personal hygiene isn't about looking perfect or meeting someone else's expectations. It's about caring for yourself, protecting your health, and showing consideration for the people around you. Throughout today's presentation, we'll discuss hand hygiene, bathing, body odor, oral care, clothing, hair and skin care, menstrual hygiene, and other everyday habits that help us stay healthy and comfortable. Let's start with a simple question. What is personal hygiene? Personal hygiene is the everyday care we give our bodies to stay clean, healthy, and comfortable. It includes habits such as washing our hands, bathing or showering, brushing our teeth, wearing clean clothing, caring for our hair and nails, and looking after our skin. These habits may seem ordinary because we do them so often, but together they have a big impact on our overall health. Good hygiene helps reduce the spread of germs, lowers the risk of infections, prevents illness, and helps us feel comfortable and confident in our daily lives. Personal hygiene isn't about perfection. It's about creating healthy routines that work for you and support your well-being. When many people hear the word hygiene, they immediately think about looking clean, but hygiene is really about health. Our bodies naturally produce sweat and oils. Our mouths contain many bacteria. We shed dead skin cells every day, and we constantly come into contact with germs in our environment. These are all completely normal parts of being human. Personal hygiene simply helps us manage these natural processes. For example, washing our hands removes germs before they can spread. Bathing removes sweat, oils, and dirt from our skin. Brushing our teeth helps prevent cavities and gum disease. Wearing clean clothing helps keep us comfortable and reduces unpleasant odors. These habits protect not only our own health, but also the health of the people around us. Before we continue, I want to recognize something very important. Around the world, hygiene routines can look very different. Things like bathing frequency, hair care, skin care products, laundry routines, or even how people greet one another may vary between cultures and climates. That doesn't mean one way is right and another is wrong. Some habits simply work better in different environments. For example, someone moving from a cooler climate to a warmer, more humid one may find they sweat more and need to shower or change clothes more often. The goal isn't to replace your culture or traditions. It's to learn habits that help you stay healthy and comfortable in the environment where you live. So what is self-care? Personal hygiene is one part of something even bigger, self-care. Today we hear the term self-care everywhere. Sometimes people think it means going to the spa, buying expensive products, or taking a vacation. While those things are certainly enjoyable, true self-care is usually much simpler. Self-care means taking care of your physical, emotional, and mental well-being. It includes getting enough sleep, eating nutritious foods, drinking enough water, staying physically active, managing stress, asking for help when you need it, and maintaining good personal hygiene. These everyday habits help us stay healthier, feel better, and improve our quality of life. One thing I'd like everyone to remember is that healthy habits are built through consistency. No single shower, toothbrush, or hand wash keeps us healthy forever. It's the small things we do regularly that make the biggest difference over time. Think about brushing your teeth. One brushing doesn't prevent cavities for a lifetime. The benefit comes from doing it every day. The same is true for washing your hands, bathing, changing clothes, doing laundry, and caring for your skin. Everyone's routine will look a little different, and that's okay. The important part is finding healthy habits that fit your lifestyle and practicing them consistently. Remember, healthy habits don't have to be perfect. They just need to be consistent. Personal hygiene also affects how we feel about ourselves. When we feel clean and comfortable, we often feel more confident going to work, attending school, meeting new people, or participating in our communities. That confidence doesn't come from trying to impress others. It comes from knowing you've taken care of yourself. Many people also find that when they take care of their physical health, they feel better mentally and emotionally as well. Small routines can improve mood, reduce stress, and create a sense of normalcy, especially during busy or difficult times. Looking after yourself is an act of self-respect, and everyone deserves to feel comfortable and confident in their own body. Now let's talk about one of the simplest and most effective ways we can protect ourselves and others: washing our hands. Although it may seem like a small habit, hand washing is one of the best ways to prevent the spread of illness. Throughout the day, our hands touch phones, door handles, shopping carts, keyboards, money, food, and many other shared surfaces. Even when our hands look clean, they can carry bacteria and viruses that we cannot see. Without realizing it, we may transfer those germs to our eyes, nose, mouth, food, or other people through the objects we touch. Regular hand washing helps remove these germs before they have a chance to spread. It is a simple habit that protects not only our own health, but also the health of our families, friends, coworkers, and the people around us. When should you wash your hands? Knowing when to wash your hands is just as important as knowing how to wash them. Some of the most important times to wash your hands include after using the washroom, before preparing food, before eating, after coughing, sneezing, or blowing your nose, after changing a diaper, after touching garbage, after handling animals or pets, after gardening or working outdoors, after using public transportation, and whenever your hands just look or feel dirty. It is also a good habit to wash your hands when you return home after shopping, visiting public places, or touching many shared surfaces. These small moments throughout the day can make a big difference in reducing the spread of germs. Now that we know when to wash our hands, let's talk about how to wash them properly. Many people quickly rinse their hands under water and assume they are clean. While this may remove some dirt, effective hand washing takes a little more time. To wash your hands properly, firstly, wet your hands with clean running water. Apply soap and lather all surfaces of your hands, including your palms, the backs of your hands, between your fingers, around your thumbs, your fingertips, and underneath your fingernails. Scrub your hands for at least 20 seconds. A simple way to remember the timing is to hum the happy birthday song twice. Rinse your hands thoroughly under clean running water. Dry your hands with a clean towel, paper towel, or hand dryer. Soap and water are always the best option when they are available. If you don't have access to soap and water, an alcohol-based hand sanitizer is a good alternative. You will often find hand sanitizer available in schools, clinics, businesses, and other public places. Another simple hygiene habit is avoiding picking your nose, especially when you are around others. Sometimes our nose feels itchy or dry, or we simply feel like we need to clean it. If that happens, it is best to use a tissue rather than your fingers. Using your fingers can spread germs to your hands into the surfaces you touch, and it may also introduce bacteria into your nose. After using a tissue, throw it away immediately and wash your hands or use hand sanitizer. This is a small habit, but it helps reduce the spread of germs and keeps both you and those around you healthier. Another important way to prevent illness is by covering your coughs and sneezes properly. When we cough or sneeze, tiny droplets travel through the air. These droplets can contain bacteria and viruses that spread illnesses such as the common cold, influenza, and other respiratory infections. If you have a tissue, use it to cover your mouth and nose. Throw the tissue away immediately afterward, and then wash or sanitize your hands. If you do not have a tissue available, cough or sneeze into your elbow instead of your hands. Although covering your mouth with your hands may seem polite, your hands then touch door handles, phones, shopping carts, and many other shared surfaces, making it easier for the germs to spread. These simple habits help protect not only your own health, but also the health of everyone around you.
Sorry to interrupt. Sophie, could you please slow down a little? Thank
Yes, for
you.
sure.
Thank you.
No problem. All right. So, another important part of personal hygiene is thinking about how our actions affect the people around us when we are not feeling well. Whenever possible, staying home when you are sick is one of the best ways to help prevent the spread of illness. I understand that this is not always possible. Many people have responsibilities such as work, school, or caring for our family members, and staying home may not always be an option. However, if you are able to rest at home while you are sick, it can help protect coworkers, classmates, friends, family members, and people in the community who may be more vulnerable to becoming seriously ill. If you do need to go out while you are sick, there are several simple steps you can take to reduce the spread of germs. These include covering your coughs and sneezes, washing or sanitizing your hands regularly, avoiding touching your eyes, nose, and mouth, and wearing a well-fitting mask if you have respiratory symptoms and will be around other people. These small actions help protect the people around you and show consideration for your community. Before we talk about bathing and managing body odor, there is something important to understand. Everyone has body odor. Every person experiences natural body smells. Children, teenagers, adults, and older adults all sweat and experiences changes in their bodies throughout the day. Morning breath, sweat after physical activity, and natural smells are all normal parts of being human. The purpose of good hygiene is not to pretend these things do not happen. The purpose is to learn simple ways to manage them so that we feel comfortable, healthy, and confident. So why do we sweat? Sweating is a normal part and important function of the body. Our bodies produce sweat to help control our temperature. When we become hot, exercise, work physically, experience stress, or go through hormonal changes, our bodies release sweat to help cool us down. Sweat itself usually does not have a strong smell. Body odor happens when sweat mixes with the natural bacteria that live on our skin. Everyone has bacteria on their skin, and this is a normal part of being healthy. Our hygiene routines can change depending on our environment. During warmer weather, many people sweat more because their bodies are working harder to stay cool. This may mean showering more often, changing clothes more frequently, and paying extra attention to areas where sweat collects. During colder months, some people notice changes in their skin. Cold air and indoor heating can cause dryness, which is why many people use moisturizers during the winter. Adjusting our hygiene routines based on the season and our environment is a normal part of caring for ourselves. A common question people have is, how often should I shower? The answer is that there is no single schedule that works for everyone. For many people, showering once a day or every other day works well. However, your routine may depend on your lifestyle, activity level, work, and personal needs. You may need to shower more often if you exercise regularly, work outdoors, have a physically demanding job, sweat heavily, participate in activities that make you feel dirty or sweaty. Some people prefer showering in the morning because it helps them feel awake and ready for the day. Others prefer showering in the evening to remove sweat, dirt, and products from the day before going to bed. Either routine can be healthy. The important thing is having a routine that keeps your body clean and comfortable. When bathing or showering, it is important to wash the entire body. However, some areas naturally collect more sweat, moisture, and bacteria that may need extra attention. These areas include the armpits, feet, groin area, an area where skin folds or touches together. Cleaning these areas carefully can help reduce odor and prevent skin irritation. It is also important to dry your body completely after bathing or showering. Moist areas, especially between the toes or in skin folds, can create an environment where bacteria and fungi grow. Good hygiene includes both washing and drying properly. Body odor can usually be managed through simple daily habits. Regular bathing helps remove sweat, oils, dirt, and bacteria from our skin. Wearing clean clothing also plays an important role because clothing can hold sweat and body oils even when it looks clean. Helpful habits include changing socks and underwear daily, washing clothing regularly, changing clothes after heavy sweating or exercise, and allowing shoes to dry between uses. It is also important to remember that body odor does not mean someone is dirty. A person may have been working, exercising, spending time outdoors, or simply having a busy day. Managing body odor is not about shame or embarrassment. It is simply one part of taking care of ourselves and being comfortable around others. Many people use products such as deodorant or antiperspirant as part of their hygiene routine. Although they are often grouped together, they work differently. Deodorant helps manage body odor by reducing odor-causing bacteria and adding fragrance. Antiperspirant helps reduce sweating by temporarily decreasing sweat production. Many products combine both deodorant and antiperspirant. There is no single product that works best for everyone. Some people prefer deodorant, while others prefer antiperspirant. Some people choose fragrance-free products because they have sensitive skin, or prefer unscented products. The important thing is finding a product that works well for you and using it as part of your routine. Some people enjoy wearing perfume, cologne, or other fragrances. Fragrance can be a way to express yourself and feel confident. However, it is important to remember that fragrance does not replace hygiene. Perfume or cologne does not remove body odor. It only adds another scent. Strong fragrances can also bother people who have allergies, asthma, headaches, or sensitivity to smells. In some workplaces and public settings, people choose to limit strong scents so that everyone can feel comfortable. Using a small amount is usually enough. The goal is to feel fresh while also being considerate of those around us. Clothing is an important part of personal hygiene because it comes into contact with our bodies throughout the day. Even if clothes look clean, they may still contain sweat, skin oils, bacteria, and odors from previous wear. Wearing clean clothing helps us stay comfortable, reduces body odor, and can help prevent skin irritation. Some clothing items require extra attention because they are worn directly against the body. Socks and underwear should be changed every day because they absorb sweat, moisture, and bacteria. Changing them daily helps reduce body odor, prevent skin irritation, and lower the risk of fungal infections. Feet spend many hours inside socks and shoes, creating a warm, moistened environment where bacteria and fungi can grow, making clean socks an important part of foot health. Doing laundry regularly is an important part of personal hygiene. Different items need to be washed at different times depending on how they are used. For example, underwear and socks should be washed after each use. Workout clothing should be washed directly after exercising. Towels should be washed regularly, and bedding should be washed regularly. Shirts should become washed when they become sweaty, dirty, or after several wears depending on use. Jeans, sweaters, and jackets often do not need to be washed after every use unless they become dirty or develop an odor. It is also helpful to follow the washing instructions on clothing labels, as different fabrics require different types of care. The clothing we wear can help us feel prepared and confident in different situations, whether we are going to work, school, an appointment, or a community activity. Dressing appropriately does not mean wearing expensive clothing or designer brands. Many people choose to shop at secondhand stores or affordable retailers, and these can be excellent options. The most important thing is that clothing is clean, comfortable, appropriate for the situation, and well cared for. Hair care is an important part of personal hygiene, but there is no single routine that works for everyone. Hair can be straight, curly, thick, fine, oily, or dry, so washing schedules will vary. Some people wash their hair daily, while others wash it several times a week. The goal is to keep both the hair and scalp healthy. Over time, the scalp naturally produces oils, and sweat, dust, and hair products can build up. Regular washing helps remove this buildup and keeps the scalp feeling fresh. Brushing or combing the hair can also help remove tangles and distribute natural oils. If you wear hats, scarves, or other head coverings, they should also be washed regularly, especially after becoming sweaty. Fingernails and toenails may seem like a small part of personal hygiene, but they can collect dirt and bacteria, especially underneath the nails. Keeping nails clean and trimmed makes hand hygiene easier and helps reduce the risk of irritation or infection. Helpful nail care habits include washing your hands regularly, keeping nails clean, trimming nails when needed, and cleaning underneath the nails when necessary. Long nails are not unhealthy, but they require extra care because dirt and bacteria can collect underneath them. Another habit to be aware of is nail biting. Many people bite their nails when they feel nervous, stressed, or distracted. Nail biting can transfer germs from your hands into your mouth and damage the skin around your nails, increasing the risk of infection. If this is a habit, using a stress ball, keeping your hands busy, or practicing relaxation techniques may help. Our feet support us every day through walking, standing, working, and exercising. Because they spend much of the day inside socks and shoes, they often become warm and moist, creating an environment where bacteria and fungi can grow. Good foot care includes washing your feet regularly, drying them thoroughly, especially between the toes, changing socks every day or sooner if they become wet, wearing clean, well-fitting shoes, and allowing shoes to air out between uses whenever possible. Keeping feet dry is especially important because trapped moisture can lead to athlete's foot, irritation, itching, and unpleasant odors. When using shared spaces, such as swimming pools, gyms, or locker rooms, wearing sandals or other footwear can also help reduce the risk of infection. Now let's talk about oral hygiene. Taking care of our mouths is an important part of our overall health. Our mouths naturally contain so much bacteria. Most are harmless, but when bacteria combines with food particles, they form a sticky layer called plaque. Over time, plaque can lead to cavities, tooth decay, gum disease, and bad breath. One of the best ways to keep your mouth healthy is to brush your teeth twice a day, as recommended by most dental professionals. When brushing, be sure to clean all surfaces of the teeth, including the front, back, chewing surfaces, and along the gum line. Taking enough time to brush thoroughly is more important than brushing quickly. Even with good brushing, a toothbrush cannot reach every area of the mouth. Food particles and plaque can collect between the teeth, making flossing an important daily habit. Flossing removes buildup from places a toothbrush cannot reach and helps protect both your teeth and gums. It may feel awkward at first, but it becomes easier with practice. Another part of oral hygiene that is often overlooked is cleaning the tongue. The tongue naturally collects bacteria and food particles as well, which can contribute to bad breath. Gently brushing your tongue or using a tongue scraper helps remove this buildup and keeps your mouth feeling fresh. Bad breath is something everyone experiences from time to time. Morning breath, certain foods, dry mouth, and not cleaning the mouth regularly can all contribute to it. Maintaining good oral hygiene by brushing, flossing, cleaning your tongue, and drinking enough water can all help reduce bad breath. If it continues despite these habits, it is a good idea to speak with a dentist or healthcare professional, as it may be a sign of another underlying issue. Our skin is the largest organ in the body and plays an important role in protecting us from bacteria, viruses, injuries, and the environment. Keeping our skin healthy is an important part of overall self-care. Our skin naturally produces oils, but weather changes, frequent hand washing, hot showers, certain soaps, and dry air can cause it to become dry. Using a moisturizer helps prevent dryness, itching, irritation, and cracking. Many people apply moisturizer after bathing because it helps lock in moistures while the skin is still slightly damp. Everyone's skin is different. Some people have dry skin. Others have oily or sensitive skin. So finding products that work well for your own skin is important. Cold weather and indoor heating can make dry skin worse. During the winter months, helpful habits include using a moisturizer regularly, applying lip balm to prevent dry and cracked lips, taking a warm rather than very hot shower, choosing gentle skincare products, and wearing gloves to protect your hands from the cold. Protecting your skin from the sun is another important part of skincare. Sunlight contains ultraviolet or UV rays that can damage the skin over time. Too much exposure increases the risk of sunburn, premature skin aging, and skin cancer. Using sunscreen when spending time outdoors helps reduce these risks. It is especially important during activities such as walking, gardening, sports, or outdoor work, even on cloudy days, because UV rays can still reach your skin. Before we finish today's discussion, I would like to spend some time talking about menstrual hygiene. This information is helpful for anyone who menstruates, as well as for family members, partners, and caregivers who want to provide support and understanding. Menstruation, or having a period, is a normal and healthy part of life. Many people experience it, and there is nothing embarrassing or shameful about it. Practicing good menstrual hygiene helps reduce discomfort, skin irritation, unpleasant odors, and the risk of infection. There are many menstrual products available, and each person can choose the option that best suits their body, comfort level, and lifestyle. Examples include disposable pads, tampons, reusable cloth pads, menstrual cups, and period underwear. Whatever product someone chooses, it should be changed regularly according to the manufacturer's instructions. Doing so helps prevent leaks, improve comfort, and maintain good hygiene. It is also important to wash your hands before and after changing a menstrual product. This simple habit helps reduce the spread of germs. Bathing or showering during your period is completely safe and can help you feel more comfortable. The external genital area can be gently washed with warm water. If soap is used, a mild, unscented product is usually the best choice because scented products may irritate sensitive skin. There is no need to use special cleansers inside the vagina. The vagina is self-cleaning, and using harsh soaps can upset its natural balance and cause irritation. Used pads, tampons, and wipes should be wrapped and placed in the garbage bin. They should not be flushed down the toilet because they can block plumbing and damage wastewater systems. Many public washrooms have small garbage bins inside the stalls specifically for menstrual products. Now that we have discussed personal hygiene and self-care, I would like to take a moment to bring everything together. Personal hygiene is about much more than appearance. It is about caring for our health, preventing illness, feeling comfortable in our bodies, and showing respect for ourselves and the people around us. Throughout this presentation, we explored many areas of hygiene, including hand washing, bathing, body odor, clothing and laundry, hair and nail care, foot care, oral hygiene, skin care, and menstrual hygiene. While these topics may all seem very different, they all have one thing in common. that small daily habits can have a big impact on our health and well-being. Good hygiene does not require expensive products or complicated routines. What matters most is finding healthy habits that work for you and your lifestyle. Everyone's routine may look different, and that is completely okay. The goal is not perfection. It is learning, adapting, and taking care of yourself in ways that support your health. Taking care of yourself is an important way of showing yourself respect and kindness. When we feel healthy and comfortable, it can positively affect our confidence, relationships, and ability to take part in everyday life. Thank you, everyone, for your time, your attention, and your willingness to learn about personal hygiene and self-care.
Thank you, Sophie, for this wonderful and informative presentation. Thank you.
Thank you
Does
for
anyone
having
have any
me.
question?
We
Okay.
have a question in the chat, Sophie.
Oh, sorry, I missed it. How often people need to wash towels and beddings? Well, honestly, it varies between people. For example, I like to wash my sheets every 2 weeks. Some people maybe once a month. I think it just depends on what is doable for your lifestyle. Towels, I think every 1 or 2 uses per towel, you should probably give them a wash.
Anyone have any question or anything they want to discuss? Okay, thank you again, Sophie.
Thank you, everyone.
Thank you. Okay, bye-bye.
Thanks.
Thank you.
Thank you. Bye-bye.